I think we've had cards distributed. Is that correct? Can we pass the cards to the middle aisle if anyone has any questions? While we're doing that, Michael Tanner, I have a few questions. On this matter of a mandate for parents to have health coverage for children, do we have any sense, is there any other nation in the world or any state that's done anything like this? And if so, what have their penalties been for parents who do not offer health care, do not purchase health care for their kids?
There is no mandate, as far as I know, exclusively for parents in any country. There are mandates in the U.S. that you have to get your children immunized before you can send them to school. And the penalty is they're not allowed to enroll in school, which is why I think he borrowed that for this plan as well. Many countries have mandates that you have to sign up for insurance, and in fact, Massachusetts recently introduced, I say under Mitt Romney, introduced a mandate in that state. The problem with these mandates is, first of all, none of them are very enforceable. In Massachusetts, I will say they've cut the number of uninsured about half in Massachusetts. Almost everybody who's been newly insured is getting subsidized care, proving that if you give people something for free, most people will take it. But very few people have gone out and bought insurance on their own. What enforcement mechanism? Try and think of an enforcement mechanism so you're going to go out and find every, homeless person and mentally ill person and illegal immigrant and, going to track them down, find out if they have the right type of health insurance and then make them pay for it. How are they going to do that? In Massachusetts, they're going to do it, they said, by making you put it on your income tax form. Well, what about all the people who don't have to file income taxes? What about people who are supposed to file and don't? I mean, heck, in Massachusetts, 7 members of the state legislature didn't file their income tax last year. So, I mean, I don't know how it works. The second thing is, when you create a mandate, you inevitably have to define what is insurance. I mean, if I have to have insurance, you have to tell me what qualifies. My $20 million deductible probably doesn't qualify to meet your mandate. So you have to start defining what is insurance. And as soon as you do that, you're creating a full Employment Opportunity Act for lobbyists. Every special interest group immediately beats its way to the state capitol and says, hey, it's not insurance unless I'm part of it. I'm a provider group or my disease or whatever it might be. So in Massachusetts, they've already started down this road. And you've had pharmaceuticals now have to be included in all insurance in Massachusetts. Then you have a limit on deductibles, only $2,000 and under. You have a lifetime cap of $5,000 introduced. The dentists lost by 1 vote, and they will be back next year lobbying to be included. Even the Christian Scientists showed up and demanded that Christian Science healers be included in the plan. So, I mean, I think it's just the first domino as soon as you have a mandate towards government-run health care.
In Massachusetts, how's that question handled with children? Are parents required to have health care for their children? And if
everyone's required.
Okay, so if a parent doesn't do it, what's the penalty?
If they leave their children uninsured, they lose their standard deduction on their income tax form the first year. After that, they're fined a penalty equal to half the cost of an average insurance policy in the state.
So serious fines?
Yes.
Okay. And in the matter of Barack Obama's proposal that you can't enroll in school, what about private schools? What about homeschoolers? There'd have to be a fine on them if school is the matter of enforcement.
Yeah, I mean, it's not workable the way, I mean, he has not given a great deal of thought to how he would enforce it. He threw this idea of school out on an interview on Fox News. It's the only time he's addressed the penalty. Beyond that, he has not thought this through.
Is McCain right that he suggested a fine in the past for parents?
I've not heard him say it. Fine for business he has talked about. He has not used the term fine or tax himself for parents, but that is the standard. Some sort of tax penalty, which you could call a fine, is the standard way of enforcement in plans that have been discussed before.
Regarding the fine for business.
Yes.
Just use your imagination for a moment and think about ways, unintended consequences and ways in which people would game that system. If you have to pay, what is it, a 7% to 14% roughly penalty for every employee you have, unless you have fewer than 10 employees.
Well, sure, you don't hire the next employee. Look, this is economics 101. As I said earlier, employers are indifferent to how they provide compensation. They don't care what's in that compensation package. So if you tell them they have to provide insurance, you're simply raising the cost of hiring a worker.
Right.
So they're going to offset that in some way. They may hire fewer workers. If they got 10 and they're going to 11, you have to start offering insurance. You don't hire worker number 11.
Or you start a separate smaller company
Or
for
you,
your next for
that's
everyone
right.
over 11.
Or you do it and you don't give anybody a raise next year that they were going to get. Or you stop contributing to their 401k.
Or you pay them under the table.
Sure.
Or
but in some way you offset that cost.
Yeah.
It's the worker ultimately bears the cost of all these things. Employers collect taxes. Employers do not pay taxes.
One more question from me, and then I'll go to the questions from the cards. The matter of the McCain plan, and I know the math is complicated, so I won't do the math, but basically, if you have a plan that's more than $14,000, the cost is more than $14,000 a year, it's a tax hike, not a tax cut. And that would apply to gold-plated plans, but would that not also apply to plans for large families that aren't gold-plated? You know, speaking as a father of 7, it's not too hard for, you know, we don't have to put too many bells and whistles on it before we're at $14,000.
Well, it's the employer contributing $14,000. Most employers won't. If you've got 7 kids, most employers aren't contributing, are starting to decrease the amount that they're contributing to your plan. You're having to pay more out of pocket now.
Unless it's family business.
Right. So relatively few employers are paying more than $14,000 a year in terms of health insurance. If they're paying 14, you're probably paying 5 or 6 on top of that. So you've got about a $20,000 policy. Could some people get caught in that? Probably.
I would say family businesses could easily get caught in that.
But yes, they could. Although you could always simply reduce the amount you're providing in insurance and get less. There's no requirement you provide any insurance at all.
Let's do some of the cards. When you said politics is about who decides, someone mentions it seems that insurance companies are deciding currently.
They are. One of the problems, and Greg's going to talk about this more extensively, that one of the problems right now is that when you buy health care, you don't pay for health care. Of every dollar spent on health care in this country, 13 cents is actually spent by the person consuming the health care, by you. About half of it is spent by the government, about 37% is paid for by an insurance company. So guess who gets the least amount of say in what goes on? You do. You know, he who pays the piper calls the tune. Right now, we're increasingly moving to veterinary care. You know, when you take your dog into the vet, the dog doesn't get a whole lot of say about what goes on. And that's increasingly is what happens when you go to the doctor. You're not paying for it, so the person who is gets to make those determinations. One of the changes we want to do in health care, and Greg's going to talk about how we do this, is take that money away from the insurance companies, away from the government, away from your boss, and give more of that money back to you so that you can begin to make more of those decisions for yourself.